Well, understanding how the Delta variant spreads among those vaccinated and unvaccinated changes day by day. Just last month, scientists were surprised at the outcome when mostly vaccinated crowds gathered in the seaside city of Provincetown, Massachusetts. And our executive producer, Hank Mendheim, was there with friends for a quick getaway, but he and his friends brought back much more than memories.
We actually felt pretty good about traveling to Provincetown. We had our vaccinations, we had taken our precautions, and the rules in Provincetown were just like the rules in Chicago. If you were fully vaccinated, you didn't need to wear a mask, and if you were not vaccinated, they strongly suggested that you wear a mask. So we did what we were supposed to be doing. People were just, I think, happy to be taking vacations. It was super crowded. You really didn't see people wearing masks, indoors or outdoors. We arrived in Provincetown on a Sunday, and on Tuesday we started hearing that people who were visiting the week before started testing positive and they were fully vaccinated. And I'll be honest with you, I thought maybe those people were lying. I thought maybe they didn't get the vaccine, but as the week wore on, we started hearing more stories. Wednesday of that week, I started with a slight cough. And then by the time we got to Friday, one of my housemates had full-on flu symptoms. So we started to get nervous around that point. My symptoms started on a Wednesday, and it was just a cough. And the cough never really got worse. I set up an appointment for a COVID test, went in after I landed, got my test, and I really and truly thought she was going to walk in the room and say, nope, it's fine, there's just some little bug going around. And she said, well, I'm sorry to tell you, but you're COVID positive. And that hit me like a ton of bricks, because I just didn't think that would happen. There were 10 of us in our group, 7 of us tested positive for COVID, and we all believed that the vaccine did what it was supposed to do. It kept the symptoms very minor. None of us ended up in the hospital, so I'm grateful for that. And I truly believe because I was fully vaccinated, that's why my symptoms were as minor as they were. I don't even want to think about what would have happened had I not gotten the vaccine.
Well, here to help us understand the Delta variant a bit more and answer some questions from you, the viewers, immunology expert Dr. Purvi Parikh. Hi, doctor. Thank you so much for being on today.
Hi, thank you for having me.
Doctor, I think this one definitely relates to me, this segment. I have a lot of questions. I'm in the same boat as our executive producer, Hank, fully vaccinated, still had a breakthrough case. It seems like we're seeing more and more of these. Are we going to continue to see this? Are we going to need a booster shot? What is next?
Yeah, absolutely. So, these cases aren't that surprising, especially when our vaccination rates aren't where we need it to be. So even when other vaccines were initially rolled out, measles, polio, there were breakthrough cases. The whole point of a vaccine is to, one, save your life and also keep you out of the hospital. So it's still doing its job, and breakthrough cases will continue. But if we really don't want to see breakthrough cases, then we really need to get more people vaccinated, because then that will really reduce breakthrough cases to hopefully even eventually zero.
Doctor, you say that we need to get more people vaccinated, right? So there are people who are going to be watching this going, well, why get vaccinated when I can still get it? I've had that conversation with a lot of people. Can you clarify and speak directly to that and still explain to folks why it is important to get the vaccination, despite the fact that the Delta variant is way more transmissible than other variants?
Right. It's still extremely important, because even with the breakthrough cases, they're significantly milder than what they would have been should someone not get vaccinated. Again, it's still showing, even with the Delta variant, that people are staying out of the hospital if they're vaccinated. It's saving their lives. The majority of people currently hospitalized, the majority of people passing away on a daily basis are all unvaccinated. So it's still in your best interest to get vaccinated. It will protect you. It will protect others. And this also helps us, ironically, get less breakthrough infections. Again, more people get vaccinated, less variants will arise. Currently, our vaccines are working well, but if not enough people get vaccinated and a newer variant comes up where the vaccines are not as efficacious, then that's a problem.
Yeah, doctor, a lot of people think that this thing is just going to be here to stay, and it will become like a flu shot where we're going to have to do this every year. I mean, it's depressing to think about that, but do you think that's a realization?
It's possible. Mutations happen in viruses. That's very normal. And we may initially need a booster, but the idea is as infections get less and less and as newer mutations stop, we might not have to do it as frequently as the flu vaccine. The coronavirus doesn't mutate as quickly as the flu virus does. So as long as we can get ahead of these infections and ahead of these variants, it may not be as often, but initially, yeah, it may be a reality that boosters are needed, and already the FDA is advocating for some to get it.
Dr. Parikh, we want to get to some viewer questions, if you don't mind. We have one right here that I think is very important. Are current COVID-19 tests effective at detecting this new Delta variant? How can the test differentiate between this strand and previous strands?
Yeah, that's a great question. So actually, the current tests, both PCR and rapid testing, don't really differentiate between them, but it can effectively pick up if you are infected with the Delta variant or not. The PCR tests, remember, are more accurate than those rapid tests. So if you're really suspicious or you've been around people who are sick, make sure you get the PCR, not just the rapid test. As for determining between the variants, we kind of assume that it is the Delta variant, as all the labs that report to the CDC are seeing that the majority of the tests are now testing for that variant. So when you get your result, yeah, it won't say you have the Delta variant or not, but it's safe to assume that you do, given how contagious it is and how widespread it is now.
Yep. All right, another viewer question, doctor. For those vaccinated, what symptoms may indicate that one has COVID? I know for me, day one, I was just really tired. Day two, I felt like I had a cold. And by day two in the evening is when I got the fever, the chills, and I knew something was wrong. Is that kind of commonplace?
Right. And that's exactly how it can come on. Also, remember that if you're vaccinated, your symptoms might be a lot milder than someone who's not vaccinated. So a lot of times, many people mistook it for allergies, or as you mentioned, sometimes it feels like just a common cold or sniffles. So again, if you're having symptoms, and even if they're on the milder side, you may want to still get tested, especially if you live in an area where vaccination rates are low and the infection rates are climbing.
Okay, we have another viewer question. This one, is my risk of being affected by the Delta variant higher depending on which vaccine I received?
Yeah, that's a very interesting question.
Yeah.
So currently, all of the vaccines protect very well against severe infection and death. We still haven't done a study where we compare all of the 3 vaccines that are approved in the US for emergency use, what we call head-to-head. That's the only way we would really know that one is better than the other. We can't really make that assessment now until they're all studied equally in the same clinical trial. But as of now, all of them will save your life and all of them will keep you out of the hospital.
All right, doctor, next question. Are masks effective against the Delta variant? And you know the debate about masks.
Yes, absolutely. They're very effective against the Delta variant because this variant is 2 to 4 times more contagious. The CDC said that you only have to spend 5 minutes in close contact with someone, whereas with original strains of the virus, it's 15 minutes. And so it does spread from person to person very easily. But if both people are masked, that spread reduces significantly. So they are still effective. And that's why we have gone back to saying, even if you're fully vaccinated and indoors in a public place, please keep masking. It's something very simple and it will save you a lot of headache and possibly an infection in the long run.
And we know this can be dangerous for children. This is our next viewer question. What does the Delta variant mean for children who are too young to get vaccinated?
Yeah, it's quite dangerous, actually. We have in certain regions of the country, such as Texas, Florida, the children's hospitals are full with kids who are unvaccinated because, there isn't a vaccine approved for emergency use in under age 12. Because it's so contagious and so virulent, kids are now going back to school. It's a real concern. This Delta variant is much more dangerous in kids than the original strains of the virus. We're seeing much higher numbers. At least 1 in 5 cases are actually pediatric cases.
Wow. I was going to ask, you touched on this earlier, how long will the Delta variant last? Will we keep seeing this thing mutate? And you basically said this is going to come down to how many people get vaccinated.
Yes, it's in our control. You know, if we are tired of the pandemic, which I'm sure all of us are, I am, we need to get vaccinated because already newer variants are being identified in different parts of the world. And we really don't want to get to that point where our vaccines aren't working as well as they are right now.
Right. Well, we hope a lot of people are listening to you. You are the expert. You are the doctor. Get off of the internet. Listen to our doctors. That's all we can say. And then hopefully people will do what they need to do. Dr. Parikh, thank you so much for joining us.